Hi everyone. So today we're going to be talking about the different pathways that you can enter into dentistry. So my name is Manasi, and I'm going to be the first half of this presentation, and Miman is going to join me the second. So these are the four things we're going to cover. So first is undergraduate entry, which is the most common way to get into dentistry. Then we have gap year / deferred entry, which is also a common choice. Then we have postgraduate entry, and finally studying abroad. So starting with undergraduate entry, so this is the most common entry pathway for aspiring dentists, and most universities will require an A-star AA. London universities will also require A-star AA, but a lot of the time people who end up getting offers have more than one A-star. Then there's also the UCAT exam. So like medicine, we also have to take an entrance exam called the UCAT, which is an aptitude test that tests you on verbal reasoning, decision making, quantitative reasoning, and situational judgment. So these first three sections are marked 900 each, and SJT, so situational judgment, that's marked from a band 1 to 4. And because of that, it's a bit difficult to give you guys an exact number to aim for, because different universities value the UCAT more or less than others. And also because recently they've changed for this year, so people who are applying in 2025, they've changed the way the UCAT works by removing the abstract reasoning section, which means that we don't have an exact number right now to give you guys, but you should aim for the top 3 to 4 percentiles. So 3 to 4 deciles. I could take up this whole session just talking about UCAT, but we do have other stuff to get to. So if you guys want a session on UCAT, you can email me or Miman, and we can arrange that for some point in the future. So there are only 14 universities that offer undergraduate dental surgery or dentistry courses, and this number is around 30 when we're looking at anything just dental related, so like dental hygiene or anything. So this is why it's even more competitive than medicine. So now I'm going to talk about the purpose statement really quickly. So that should be tailored specifically toward dentistry, with any work experience, volunteering or extracurriculars you've done, tying back into skills you need for dentistry. So for example, let's say I was a pianist, so I could say that by playing the piano for so long, it's helped me develop my manual dexterity, which is a really good skill needed for dentistry. Next, we go to gap year. So this is also a really common entry into dentistry. So there's a lot of different benefits you can get from a gap year depending on the nature of your gap year. So it gives you time to improve your mental health, focus on A-levels rather than applications, and time to retake any exams if needed, whether that be your UCAT or your A-levels. And it also gives you time to strengthen your application, so for example getting more work experience or things like that. So there's two ways you can approach a gap year. One is not applying at all in year 13, and then applying the year after once you have your A-levels. Again, this is the route that allows you more time to focus on your A-levels and stuff. But the other way is also deferred entry. So that will be when people decide ahead of time that they don't want to go to university as soon as they finish their A-levels, maybe because they want to travel or save money or stuff like that. And what will happen in this one is you apply in October of year 13, but when you're applying you select a deferred entry, which means that when you get your conditional offer, you'll have your conditional offer, but it will be with the dates for your deferred entry. There's also no limit to the amount of times you can reapply. but some universities do require your A-levels having been taken within 4 to 5 years of you applying. Okay, now I'm going to hand it over to Miman, who's going to talk about postgraduate and studying.
Okay.
Hiya.
Hi everyone, so I'm going to talk about postgraduate entry. So first we'll look at what is the point of postgraduate dentistry. So why should you do postgraduate dentistry? So first of all, it allows you to specialize in one of the 13 specialties, such as orthodontics or periodontics. Second of all, it helps develop the range of treatments you can offer as a general dentist. So even if you choose not to specialize and you become just a general dentist, you can still perform a greater range of treatments for your practice. Third of all, it increases job opportunities, security and salary, of course. And fourth, opportunities for research and publishing, which are especially helpful for those interested in the teaching or policy making of dental education. So if you do postgraduate dentistry, there are a range of jobs you can pursue. It doesn't have to be necessarily a clinical dentist. You can, be a dental researcher, publisher, or teach dentistry to people at university or such. And last of all, an internationally recognized qualification, so it might allow you to migrate to find work in another country in case you want to leave the UK. Next, let's look at types of postgraduate training. So we have specialist training.
Do finish.
We have advanced clinical dentistry, PhD in dentistry, and dental core training. Each of these have a different duration of the course, and these allow different things. So for the first, it allows you to be a registered specialist with the DBC, such as orthodontics or periodontics, as we mentioned before. This one allows you to have enhanced general practice skills, so as we mentioned, it correlates over here. This one allows you to offer a greater wide variety of treatments for your dental practice. And the PhD in dentistry and dental core training allow you to have research in academia and hospital dentistry experience. Now, moving on, how to actually get into postgraduate dentistry. If you have a BDS, you can apply directly to all of the previously mentioned postgraduate options, so the 4 that were here before. And for example, the specialist training programs are extremely competitive due to limited spaces, and they are funded by the NHS. So of course, we're talking about postgraduate here, so this is really competitive. It means that more people are applying for a very, very small number of spaces. Acceptance rate varies by specialties, but ranges from 5 to 20% of applicants. Now, what happens if you have a biomedical related degree? So people might choose to do an undergraduate degree in something biomedical related. And if you want to do postgraduate dentistry after that, you can actually apply directly, and you will not have the required prior training. So obviously, if you did an undergraduate degree in dentistry, you'd have more training, specifically for dentistry, which you won't get in another degree. And an alternative route is graduate entry dentistry, which lasts another 4 years. So with this one, you will be spending a lot of time. If you already spent 3 years in a biomedical related degree, that will be a total of 7 years just in university. You need a 2-1 minimum in your biomedical degree. So when you take your exams throughout your degree, you'll graduate with honors, or you get a 2-1 and such. So you need a minimum of this to actually get into postgraduate dentistry. But this one also allows you to become a fully licensed dentist. So if you for example, have a midlife crisis and you've done a biomedical related degree, but you want to become a dentist in the end, then you still have time. If you spent 3 years in university, you can still choose to be a dentist. But this is extremely competitive with a 6% acceptance rate, so that's 1 in 15 spaces. So you're competing with 14 other applicants if you do get in successfully. And a few universities provide this course. So also, due to few universities providing this course, e.g. Aberdeen and KCL, question, how many spaces do you think there were? Okay,
what?
Who wants to have a guess at how many postgraduate spaces you think there were at Aberdeen and KCL?
5, 3, 100.
5, 3, 100. Okay,
6.
correct. Yeah, who said 6?
Me.
Well done, Nikia.
Wow.
The answer is 6.
Okay, I am going to set up my lesson soon, thanks, just so you know. I am teaching in here. Yeah.
postgraduate dentistry is much more expensive than a standard dentistry BDS, and only years 2 to 4 are eligible to be NHS funded. And the last one is studying abroad. I'll go through this really quickly. It's an alternative pathway from a dentistry BDS or graduate entry dentistry, and you must choose a degree abroad recognized by the GDC to return to the UK. The best countries without additional exams include Spain, Portugal, Italy, and Poland, and popular countries that do include additional exams are Hungary, Romania, and Ukraine. And these tend to have easier admissions, so if you have the money, it's like a viable way to actually get into dentistry. It's fully self-funded, and it's really expensive for non-UT students because you need to like factor in rent, travel, cost of living. Also, there will be language barriers. Obviously, if you're moving abroad and studying, you need to make sure that you're learning. If you're learning, it has to be in a language that you understand. So you have to check that they teach it in English. And also, just living there for the whole duration of your degree, you need to consider the whole thing. So you need to adjust your whole lifestyle to a different country, which is crazy. Thanks for your attention, guys.